Good morning, students. I apologize for canceling class today. It took me over 2 hours to get home last night, and a lot of the roads were pretty much iced over, and now snow has fallen on top of that this morning. So it makes no sense to me to drive all the way to La Crosse for just one class. Not that you're not worth it, but I'm sure you don't mind not having to come to class as well. So I'm going to present the information that I would be giving you in class today through this, and you can watch this on your own time. I'll have it up, of course, by 11 o'clock so that you can watch it during your normal classroom time. Remember, we will be having a quiz on Thursday on both chapters 1 and chapters 2. It's a 10-point quiz. Go through your notes, things that we discussed. It'll all be on actual information that we discussed in class. It won't be on other parts of the chapters as well. So anything that we discuss in lecture is up for grabs. So be prepared for that. It will be in paper form, and we will take it at the beginning of class on Thursday. The other thing that I was going to do today in class was have you do an activity regarding you in the communication process and where you fit. So we will do that on Thursday after we're done with the quiz. The last thing that I want you to do is make sure you get out there on that discussion board and get your topics posted. And I'm going to come in and I'm going to start asking you some questions about that. So be ready to reply as well. We would have had these discussions on Thursday, but since we already started this discussion board, I see no sense in taking actual class time to have you come out of the room with me and discuss it. I think we can discuss it through the discussion board just fine. And then on Thursday, if there are any lingering questions or concerns, then we can discuss those then. So for right now then, what I would like to do is I would like to go over the PowerPoint with you. And these screencasts usually can only be done for 15 minutes, and it looks like I've already used 3 minutes. So I'll probably have 2 parts to this. And then the link will go on YouTube, but I'll post the link for you as well. All right, so Professional Guides for Nursing Communication. This is Chapter 2 in your textbook. These are the objectives that we're going to be looking at today. Describe the impact on nursing communication of standards, guidelines, competencies, looking at QSEN, which is a quality thing, so looking at quality when we're talking about communications, legal and ethical standards, and then, of course, we will look at the HIPAA Act, which we probably don't need to do a lot of discussion because everybody is quite familiar with it. All right, so remember that effective communication is a two-way exchange of information among clients and healthcare providers. We've talked about this before. There has to be a sender of a message and a receiver, so it's a two-way. And everything has to be understood or there was no communication. This goes back even to health assessment when you guys were learning how to do the interview and the health history. If one or other of the parties involved don't have any understanding of what is being discussed, then there was no effective communication. So it needs to be timely, it needs to be accurate, and it needs to be usable. Those are the 3 things I want you to remember. Communication needs to be timely, accurate, and usable. So sometimes I said to you that you may, you have to have understanding, so you may need to go back and forth between the parties involved until understanding is reached by all. The things that you need to remember is, and these are kind of your standards of communication, your guidelines. All communication needs to be clear, concise, concrete, complete, and courteous. Communication problems can stem from system failures. They can also stem from transmission failures and they can stem from reception failures. So communication problems stem from system failure. So what might happen is there are communication channels that are available for communication, but they're not working properly. All right, maybe it's an email. You're sending email and you're communicating through email, but it's not working properly. Something's going on. So we have a problem at a system level with communication. The second way is for the transmission failure. And this is where we have the channel for communication, but the message isn't being sent, or it's not being sent clearly. Okay, so that's a transmission failure. And the last one is a reception failure. So this is where we have those channels again. Channels are available for communication. A message is sent, but it's misunderstood. It's not clear enough, so it may be misunderstood. I've always tried to, even in health assessment, remind you that any communication that you need to send out needs to be courteous. If we look at this slide again, the last one says courteous. If you send an email, you have to have professionalism in that email as well. And it has to be courteous. Otherwise, people can misunderstand what you're trying to say. Remember, email is a great tool for communication, but there can be a lot of misinterpretation. The way you state things, how you state them, never type anything in all caps because that can insinuate that you're yelling. There's lots of little rules that are really important to follow when you're dealing with that. Remember that nurses are trying to provide the safest and the best care for our patients. And so we need to have these communication standards. We need to have them available in order to provide that safest care and that best care. All right, so what I'd like you to do is I will read through this real quick for you, and you can pause this and just think about this and answer these questions at the end. So this is a case study, an example of a graduate nurse. So as you see, her name is Kay Smite. She graduated, so she's considered a GN, a graduate nurse. She's not a registered nurse yet. She hasn't taken her boards. She takes on an entry-level position on a busy surgical unit in a small hospital. She's had no orientation. She was assigned to work an evening shift with one registered nurse and 2 aides. During her second week, when the registered nurse calls in ill, she's told by the evening supervisor that she is charge nurse, and a float nurse will be sent as soon as possible to help with the workload. A surgeon arrives and rapidly gives verbal instructions to limit his pre-op craniotomy patient's hair shaving to the incision site only when the preparation procedure is done in the operating room tomorrow. As a student, Kay never spoke to a physician. He writes an order stating client will be shaved according to head nurse's instructions. He asks Kay to call the operating room to relay these instructions, which she does. Nothing is in the record describing the area to be shaved. When the day shift arrives in the surgical suite, the telephone message from Kay is not passed on. The client's head is completely shaved, and a lawsuit is threatened. So what standards of communication were violated? What do you think is wrong with this entire work environment? What would you change in this unfortunate but true situation? I want you to pause this, and I just want you to answer these questions before you listen to my answers. Just see if you can come up with some of the things on your own. Okay, so if you paused and then you started up again, you should be where I am at. And there are different things that I want you to think about. So what standards of communication were violated? Well, we just talked about things being clear, things being concise, concrete, courteous. So I think the first one, in my opinion, that was violated was clarity. There was no clarity with that particular order, and there was no clarity as to exactly how Kay should be able to communicate it. Was it courteous to make her the charge nurse? She was a new nurse. And not only that, but they sent a float nurse to help her out. So it was someone who probably wasn't used to working in that particular area for very long. So I don't think the courteousness was there for that particular part of the situation. How about the conciseness of the doctor's orders? It didn't specifically say exactly what needed to be done. It left it up to the head nurse. Well, again, for clarity, which head nurse is he talking about? Is he talking about the head nurse in surgery, or is he talking about Kay, who was considered the charge nurse at this particular time? So clarity, again, I think was missed there. Clarity of the verbal orders. He did tell Kay certain things, but he didn't tell her exactly what to say. And in her situation, I probably would have asked more questions saying, okay, tell me exactly what you want me to tell them. And the completeness of his order. I think that wasn't, I don't think that was there as well for all of the reasons we discussed. So what do you think is wrong with this entire work environment? Obviously, I don't think that she should have been made charge nurse. I think they should have had try to get somebody in there with more experience to help her out. Maybe they weren't able to do that, but maybe this is where her supervisor needs to come in and do a little help with that. What would you change in this unfortunate but true situation? I guess I would have, like I said, had someone a little bit more experienced in there in that charge nurse position. I would have Kay try to ask more questions. And I would go back to her student experience where it says she never talked to a physician. That brings up a red flag to me as well, that we need to look at all of our students and make sure that they are able to communicate professionally with everyone, including physicians, and not feel uncomfortable about it. So that's something that you can carry on into your practice, and when you get out into your adult clinicals and that, don't be afraid to talk to those people and don't be afraid to ask those questions. All right, there are different organizations that issue communication mandates. We have the World Health Organization, known as WHO. We also have the Institute of Medicine, the Agency for Healthcare Research and Quality, AHRQ, the ANA, American Nurses Association, and the Joint Commission. So these are all found on page 23. A couple points that I saw in your book that I want you to think about is WHO issued 9 solutions for increasing healthcare safety, including identification of the patient and better communication during patient handovers. So if you look at that, you'll see information about how information passed from one nurse to the next nurse can greatly affect that safety of the patient. So that communication is vital. The Institute of Medicine's, what they found that I thought was interesting was that poor communication was a causative factor in 70% of healthcare errors. So they advocate for standardized communication tools. And if you look at page 24, there's one called the SBAR. You're going to be hearing about SBAR as you go through, and that's the handoff. So this is where nurses will communicate with each other as they pass off care of their patient to the next nurse and that is taking care of that patient. The AHRQ looks to improve client safety. It publishes best practices, so we talk about that to you all the time. We say best practice. The ANA issues scopes and standards of nursing practices, and I'm sure that you've already looked at the scopes and standards probably in your concepts class. And then the Joint Commission, they regulate the hospitals. And one thing that I saw in your text that was quite interesting is that they found that 60% of sentinel events, so these are huge life-changing events that happen to patients, 60% of these sentinel events is attributed to miscommunication. So if you're wondering why it's important for us to have these discussions with you, have this class on professional communication, I think that can, right there, can tell you a lot. All right, looks like I only have about 30 seconds left, so I'm going to stop this recording and I will start the second one. So I'm going to pause this right now and I'll see you back in a couple minutes.